close and I'll pop up the screen. Okay. You're good, Katie.
Uh, Good morning, everyone. Thanks for joining us today. This is the City of Charleston Health and Wellness Advisory Committee meeting. And I am hosting this meeting this morning for Councilman Shealy, who had a prior commitment that he couldn't get out of. So on behalf of him, welcome. And I call this meeting to order. Paul shared out the committee minutes for April. If there are no edits, do I have a motion to approve?
I motion.
Thank you, Dr. Durst. Do I have a second?
A second.
Thank you. All right. All in favor, say aye.
Aye.
Wonderful. Thanks. All right. Well, we will move on. We have a wonderful outside speaker here today to talk to us about lung cancer screening. This is Raga Subramanian. She works with the American Lung Cancer Screening Initiative, and we look forward to hearing from her now. So, Raga, feel free to pull up your PowerPoint and the floor is yours.
Hello, everybody. My name is Raga. I'm a student at Boston University. And let me share my screen so you can see. Can you see my screen?
Yes.
Okay, so I have a quick presentation introducing our nonprofit and a little bit about lung cancer screening. So, who are we? So, our nonprofit consists of over 500 plus students, physicians, lung cancer survivors all across the nation, and we have 56 ALSI chapters all across US and Canada. Since our conception, we've had over 500 plus students, physicians, lung cancer survivors, and like over 700 plus community events. And this has led to over 35,000 conversations about lung cancer screening. Other than direct engagement with the community, we believe that advocacy is key to long-term improvement. So here's a picture of our team at the Rayburn House of Representatives this year, where we advocated for bills to increase access across all lung cancer screening. We've collaborated with 104 government officials and physicians to receive PSA videos, including your former mayor of Charleston. We've also received 574 proclamations all across the US and Canada declaring November as Lung Cancer Awareness Month. This has led to an anonymous vote in the Senate to pass a resolution declaring November as Lung Cancer Awareness Month in 2020, 2021, and 2022. We've heard from so many people that this has made them feel heard and that it's meant a lot for a lot of cancer patients. So you may have been wondering why we chose lung cancer screening as the main public issue to focus on. To understand lung cancer, we have to talk about who's at risk for lung cancer. Truthfully, anybody with lungs can get lung cancer, that in any age, any level of fitness, and any level of health. But there are people who are more at risk, and that is people exposed to a gas called asbestosis or radon. So radon is this odorless, colorless gas that can enter homes, school places, workplaces through sediment, and it causes 21,000 lung cancer deaths every year. And actually, 1 out of 15 homes in South Carolina have an elevated level of radon. People who smoke cigarettes in the past or currently are also at higher risk. So in 2022, 15.4% of South Carolina were currently smoking cigarettes. However, there's a proportion of people who have a cigarette smoking history. So lung cancer is a critical issue because it's the leading cause of cancer-related deaths in the US. As you can see here, that over to 120,000 people pass every year from lung cancer, and it causes more deaths every year than breast, colon, prostate cancer combined, and many people never think or heard about it. One of the reasons lung cancer is so deadly in its current state is because almost half, 48% of people diagnosed, only find out that they have cancer when the disease is in the late stage. At the late stage, only 7% of people live more than 5 years. But lung cancer doesn't have to be this deadly. The earlier we catch it, the better lives people can live and the more time they can have with their family. The problem is that lung cancer is silent until it gets to these stages. You don't have a signal to go to the doctor like cough, chest pain, fatigue, pneumonia, or any other symptoms until it's too late. The only way to catch cancer early is through screening. So we looked at Charleston County specifically, and between 2017 and 2021, there were 1,374 new cases of lung cancer. For every 100,000 people, 52 lung cancer cases were reported, and 815 people have actually passed away between 2018 and 2018 and 2022. But like we mentioned before, lung cancer screening saves lives. So here are the lung cancer screening guidelines that you could think about for yourself or your friends or family members to see if they qualify. So if you're between the ages of 50 and 80, if you smoked about a pack of cigarettes every day for 20 years, and if you quit within the past 15 years or are currently still smoking, if you fulfill these three requirements, you could be eligible for lung cancer screening. Lung cancer screening itself is a CT scan. It's super fast, less than 5 minutes. No needles. You can eat normally, wear your normal clothes. It's very similar to a mammogram, which is a breast cancer screening. So currently, the national average of people who are eligible for screening who are actually getting screened is 16%. South Carolina is doing better than the average at 16.7%. However, if we look at breast cancer rates, they have a screening of almost 77%. So there's a lot of room for improvement. And here are some institutions that people in Charleston could get screened at. The MUSC Screening Center is actually just a 5-minute car ride from the city hall. So here's a few things that we can do to help increase screening in Charleston. So first, we have a letter of support for two bills which would increase access for lung cancer screening. If you guys are able to, I would love to send that out on how you can do that. And then also another thing we can do is spread the word about lung cancer screening. I can also share resources like flyers and like little notes to like put on like newsletters to help like share it with your family and friends. Okay, that's it. Thank you so much. Do you guys have any questions or comments?
Thank you, Raga. This is good information. You may have already said this, but do most insurances cover this screening for those that meet those three criteria?
Yes, they do. So if you have like if you meet the criterias, then it should be covered under insurance if you're insured.
Thank you. Any other questions for Raga?
Just Rog, if you would send us that information, I'm not sure whether I have it or not, but if you'd just resend it, I'll make sure I pass it out.
Yes, of course. I'll send it to you.
Katie,
Yes.
Dr. Richardson, I wanted to say, Rhonda, thank you very much. I'm a family physician and represent the Charleston County Medical Society. So thank you. It was a wonderful presentation. And I do agree, MESC, Roper, East Cooper, a lot of the hospitals do it and many of your physicians aware of it. And I know they do several outreach programs, and as a physician who does order this a lot, it has saved a lot of lives, and most insurances, I say, do pay for it. So thank you very much.
Thank
Of
you for
course.
the local perspective, Dr. Durst. I think I was particularly moved by the statistic that only 16 almost 17% of people eligible are getting that screening. It's a once a year screening or a yearly screening for folks in that that meet those three criteria. One time. Okay.
No, once a year, once a
Oh,
year.
once a year. Okay.
Yeah, you have an
Wonderful.
annual screening and then a baseline once a year. Usually the insurance pays once a year. Yeah.
Thank you.
And it's great that what she said too, that's important, that a lot of people think, well, I quit smoking, and that's awesome. But it does go back, like she said, depending on your pack year, to 15 year, if you quit within 15 years after age 50. So that's the thing. A lot of people think, oh, I don't smoke. Well, you used to smoke, so you would qualify. So thank you for saying that.
Yes. Thank you very much. You're welcome to stay, Raga, and then, and participate in the rest of the meeting, or if at any time you need to, you're welcome to drop off. But thanks again for joining us. Are you from South Carolina? Okay, well, regardless, maybe you'll consider moving here one day, and thank you for helping to educate us and the public.
Yeah, I'm from Connecticut, but
Okay.
my brother was born in South Carolina,
Okay.
so
All
I
right,
have some
good connection. Yeah. Well, thanks again. Okay, so I think I do have the agenda somewhere. I think that the community health updates are next. Is that correct, Paul?
Yes.
All right, so I would like to start with a shout out to our Charleston County Medical Society and Dr. Durst and her team. The South Carolina Medical Association just had their annual conference, and at that conference, Charleston County Medical Association and two of its committees were awarded we're given awards this year, and Dr. Durst was there to accept them.
Yes. Thank you so much, Katie. And I really appreciate it, especially Dr. Katie Richards on our school and health committee that we won. And these are very big awards. We compete against all counties in South Carolina. So it was great. And our first award was the South Carolina Healthy Children in Our Communities Award. And we had Dr. Jan Key and Dr. Oots, but Dr. Jan Key came and talked to us at our meeting the other day about our initiatives in the community. And this school health committee does not include just physicians. It includes residents, medical students, school health nurses. Some of y'all, I think, are on the committee also. People in the community, some of the different administrators, employees of the Charleston County School. We also do Berkeley County School, but this award was particularly for our medical society. And the criteria is given to a county medical society who's promoted a healthy living project to promote youth ages 11-18 with a notable physician champion that has encouraged the value of healthy choices. So we commend our group, and it was such a pleasure to accept that award. And then the next one on, thanks, Katie, you have it there, is we were very surprised. We thought that was it. And then we got another award, and it was the South Carolina Community Service Award. And we were very honored to win this award. And our physician who's our champion is Dr. Thaddeus Bell, that a lot of people know. He has done a lot of work at MUSC in ethics, and his committee did a lot. They also work with the Outstanding Service and Devotion to promote, which I think you have there, healthcare literacy and decrease healthcare disparities in the African American communities and underserved communities in South Carolina. He has the Closing the Gap Healthcare Initiative, which we support and collaborate. And then we also support their initiative, which I really encourage y'all to go to, is the Low Country Jazz Festival put on with the city and the Gilliard, always on Labor Day weekend. And the money that's raised for that goes to scholarships and help with these initiatives. And the criteria for this award is given to the County Medical Society for its service to the community and efforts to promote health for South Carolinians through a service project initiative or support. So we're very proud of that, and thank y'all to everybody who has been on the committee. And if anybody would like to know more about it, I can get some more information, and we're very proud of this. So thank you very much for putting that out, and Paul too.
Thank you, Dr. Durst. This is a huge award and wonderful recognition for all that the County Medical Society does for the community with the support of the county's physicians and other partners. So congratulations again.
Yeah, thanks. And thank you. I know Dr. Richardson's been there for a long time too, helping. And like I said, if anybody wants more information or be involved, I'll send some stuff with Paul, especially the Low Country Jazz Festival. You don't have to, I mean, that's open to everybody. And we have some great lineups coming. It's been going for about, I think, 15 years, but I know over 10.
Yep.
Thank you.
Thank you. May is a busy month. And I look forward to hearing from others on the committee about what's going on, but I wanted to highlight a few issues of public health interest. The first of which is each May, beginning with Mother's Day, we celebrate National Women's Health Week. And so this starts the day after Mother's Day, and it's really aims to highlight women's health issues and priorities, and encourage women of all ages to prioritize their physical, mental, and emotional well-being. This year, the messaging or the themes are really around encouraging women to engage in healthy practices, to access preventive care, and to share their health experiences to inspire others. And this website, which Paul shared out before the meeting, each day has a different emphasis. And so it starts with, as you see on the left there, empowering women in their health journey. And that really sort of highlights how to make yourself heard at your healthcare visit. Make sure that you get all of your questions addressed. And it's also highlights the importance of finding health information that you can trust, depending on reliable sources for that information, and when in doubt, asking your healthcare provider. So that's day one, and there's lots of resources under that. Day two talks about safe sexual health, how to prevent sexually transmitted infections, and the importance of consent. And communication in safe sex practices. Day three is entitled Shining a Light on Maternal Mental Health, and talks about mental health during pregnancy. It talks about the postpartum period and the importance of recognizing concerning signs at that time, reaching out for help, joining groups, support groups, taking care of yourself, and then certainly speaking up if there are any concerns. So it mostly talks about pregnancy and postpartum, but of course, parenting, including mothering, can be stressful throughout that journey. And so definitely important to take time for yourself and to seek help if needed. On Wednesday, it's reducing women's health stigma. Talks about menopause and menstruation, and the importance of sort of feeling like those topics can be discussed out in the open with your healthcare provider, should you have any concerns or questions. Thursday is Understanding Care is There. That returns to sort of the power of routine care, the importance of checkups and screenings like we heard about today, as well as vaccinations, and keeping up with those healthcare recommendations and the importance of maintaining health that way. And then Friday talks about reproductive health from puberty to menopause and beyond. And that includes family planning and and other items. And finally, the week ends up with women and heart health. As we spoke about, I think it was in February when we talked about Heart Health Month. Heart disease is the leading cause of death for women in our country, and certainly prevention is very important. It also talks about recognizing the signs of a heart attack in women, that those may be different than what we often talk about, or those in men. And day 7 also includes resources about the importance of maintaining a good blood pressure, cholesterol, knowledge, and control. And then, of course, as we always come back to physical activity and healthy eating. Dr. Durst, do you have any other comments about just women's health and this week in general?
No, I think that's great that you pointed it out. And I do agree with, everything you said. And I think there's a lot of initiatives, especially in the menopausal and puberty issue right now, a lot of the stuff out there. I think it's great. Thank you very much.
Absolutely. Thank you for your input. I want to move on, and I did not send a link to Paul about this, but May is also National Hurricane Preparedness Month. The focus is really around National Hurricane Preparedness Week, which is now in early May. And we do it this month because the Atlantic hurricane season does begin on June 1st. And so this is really a time for individuals, communities, and organizations to prepare for potential impacts of tropical storms and hurricanes. And some of the themes that Department of Public Health and partners in South Carolina are promoting this month are really understanding your risk. So please know your hurricane evacuation zone, as well as flood risk. We're asking all families to prepare an emergency kit that might include food, water, medications, flashlights, radios, important documents. Usually a 3-day supply is recommended for each family member. We want to talk about establishing a plan, a communication plan for your family, as well as an evacuation plan, knowing that wireless networks may not be working, and we're so dependent on our phones. But are there meetup points and other ways that you might think about ahead of time for communicating with your family during a time like this? And then, of course, it's helping the community, sharing these preparedness tips and others, assisting vulnerable neighbors during times of a hurricane or other event like that. And finally, staying informed. You can sign up for emergency alerts, monitor trusted weather sources, and the South Carolina EMD, Emergency Management Division, I believe, puts out a hurricane guide every year, and that is available now for 2025. It was released on May the 1st. So just a few hurricane tips. We live in a very beautiful place, but hurricanes are one of those things that we must deal with when living here in the South Carolina Low Country. I also want to talk a little bit about sun safety, because we're coming up, we've already gone through spring break, but we're coming up on summers, and we're very fortunate to live near the beach. But skin cancer and sunburns can be very risky to our health. So this website discusses several ways to protect yourself from the sun. We all know these, but I think they're good reminders that, being in the shade certainly helps, although it's not fully protective. So sitting under an umbrella or a tree or other form of shade, wearing clothing certainly helps to protect from the sun, whether that's a beach cover up or a long sleeve shirt and long pants, depending on where you are. A wide brimmed hat that not only covers your face, but also ears and the back of your neck is important, as are sunglasses that help to prevent cataracts, protect our sun as well as the skin around the eyes. And then the importance of a broad spectrum sunscreen, SPF 15 or higher, is very important. Sunscreen is not recommended for infants age 6 months old or younger. And so babies, infants of that age really need to be kept out of the sun. And then, of course, there's the importance of reapplying after swimming or after 2 hours to make sure that that sunscreen continues to work. And then this time of year, I know I need to go through my sunscreens and make sure that the expiration date has not already been reached. That might be even, necessary to get rid of that sunscreen sooner if it's been sitting in a high car or otherwise outside. So just a little bit about sun protection. I want to briefly, Paul is sharing here where sunscreen is available in the city of Charleston. This is a wonderful initiative that many tourists and those who live here may have forgotten their sunscreen when they're out and about. And so knowing that these sites are available for being able to reapply sunscreen, I'm really glad that we have these in the city, and this is available on the City of Charleston website. I just want to mention allergy season. Probably doesn't need mentioning. We probably all know it by being outside, but this is one of the worst allergy seasons in recent years. Much of the country, and especially the South, is experiencing medium to high allergy levels right now. Record levels of pollen have been found in Atlanta already this year, and we know that allergy season is becoming longer. The plants are releasing pollen earlier, up to 40 days earlier in the year, and the pollen is going on later, also about 2 weeks longer than it used to, and this is due to rising temperatures as well as an increased amount of carbon dioxide in the atmosphere. And this just means that our immune system is therefore more irritated by these pollen grains. So 2 recommendations: one, rinsing your nose with saline water, sort of like brushing your teeth, just a way of getting that pollen out of the area where it's most likely introduced into our bodies. And then if medication is needed, a second generation antihistamine like Zyrtec is really preferred over Benadryl. Benadryl has been around since the 40s. We certainly do use it for certain things, but for allergies based on outdoor allergens, it really has a lot of side effects compared to a Zyrtec or Allegra. So those are just a few thoughts with allergy season. And I looked at the weather forecast. We may get a little rain this weekend. That would certainly help to calm down all the pollen. And then I just wanted to finish by going back to earlier in the spring. And we had a tragic situation happen with a low country family vacationing in Costa Rica that many of us may have seen in the news, where one of the sons of this family died and was found to have died due to carbon monoxide poisoning. And so just wanted to touch on what is that, and certainly want to do what we can to prevent further illnesses and deaths from this carbon monoxide. So it's an odorless, colorless gas that can kill without warning. It claims the lives of hundreds of people every year, and that makes thousands of more ill. And many household items, including gas and oil burning furnaces, portable generators, and charcoal grills, can produce this poison gas. The most common symptoms are headache, diarrhea, dizziness, upset stomach, vomiting, chest pain, and confusion. And these symptoms are often described as sort of flu-like symptoms. Everyone's at risk, but as is true of so many things, the young and the old and those with chronic disease are at increased risk. And several ways to reduce our risk include using carbon monoxide detectors. These can be bought and are not very expensive and can be placed in your home. And then just making sure that we keep our heating systems, water heaters, any other gas, oil, and coal burning appliances serviced. Making sure our gas appliances are vented properly, never heating a home with a gas oven, or cooking on a fireplace or stove that isn't vented, having your chimney checked and cleaned each year. Charcoal should not be burned indoors. Portable camp stove should not be used indoors. Chemical heaters are also a risk when used indoors. A generator should not ever be used inside, even if the doors and windows are opened. When outside should be at least 20 feet away from any windows, doors, and vents. And then finally, cars can also be a risk for carbon monoxide. So do not leave a car or truck running inside of a garage. One that's attached to the home can be a danger even outside of the garage, even in the home itself. So just a few tips about carbon monoxide. And then finally, there was some talk about potentially being the death being related to food poisoning. So food poisoning, we do see it. I'd love to hear Nick's thoughts when this is my last item. We do see more in the summer. And so I just wanted to touch on here some of the most common causes of food poisoning include norovirus, salmonella, and campylobacter. We also hear talk of listeria because there can be food recalls, certainly with listeria. So just as far as prevention, this emphasizes, and we talk about clean, so just making sure your foods are washed properly prior to eating. Separate out, say, your meats from your your raw veggies, those sorts of things. Make sure things are properly cooked, so cooked to the correct temperature. And then don't leave food out for too long, especially in the summer. The picnics and those sorts of things, once the food has been out, don't leave it out too long. And then when it has been left out, it's probably not safe then to store and eat later on. So some symptoms of food poisoning include diarrhea, stomach pain, nausea, vomiting, and fever. And reasons to seek help would be if you have symptoms of bloody diarrhea lasting more than 3 days, any high fever, vomiting enough where you're unable to keep liquids down, and if there are any signs of dehydration, again, that you're not able to keep up with the fluids that you can take in. Nick, do you have any other comments around food safety for the summer?
No, I think you captured it incredibly well. I mean, I will say, obviously, food safety is something that's incredibly important to the work that we do. And obviously, food safety standards are something that we have to conform to incredibly tightly. I mean, our staff, our partners are trained in food safety standards. The facility here in Charleston, also our other facilities as well. I mean, we monitor food safety to very high standards in terms of monitoring the temperatures of our refrigeration units. So again, the whole refrigeration and making sure, as you say, that food is not left exposed and out in warm temperatures, obviously, is very important. Now, I think you covered it very well, Katie. Thank you so much.
Thank you, Nick. So I know that was a lot of topics, but that's why I appreciate Paul sharing out the web pages, and just as always, your help in getting the word out to those that you serve and interact with around these important public health issues at this time of year is greatly appreciated. So any questions about any of that I can address? A lot of information. I know. All right. Well, at this point, I want to open up the floor. I know that Paul has an update from Morgan Huey. Do you want to start, or let's start with Jennifer Brush? Although, did she drop off, or is she still on?
No, I'm still here.
Oh, great. All right, Jennifer, tell us about the mental health conference.
I figured that would be my cue, right?
Exactly.
Katie, that's a lot of information. Thank you. That's there's so many things to know and keep up with, and that's I feel like I learned a lot today. So thank you. Starting out the day well. But yes, we do have our mental health conference coming up in 2 months, and it's at the Gilliard, and Paul has the website up. We have great speakers again this year. It starts on July 30th in the evening. We have some evening sessions, and then it runs all day Thursday and all day Friday. And you can go virtually or in person, and he's sliding to the speakers. We can send another link to anyone if you're interested in going. We have about 90 sponsors and exhibitors at the conference. So it's really a great place to network and learn what's out there for people with mental health and drug and alcohol use and treatment, and veterans. And there's just a lot of people here will be at the conference. And so thanks for supporting us. But we have another great, exciting year again this year. I think it's our 13th year. So thank you, Paul. But for Department of Mental Health, I have interesting news. So finally, after, I don't know, a year and a half of trying to combine us with other agencies, it has been signed by the governor. We actually are now combined with DAODIS and with DDSN, and our new name is the Department of Behavioral Health and Developmental Disabilities, and we will become the Office of Mental Health. They'll have the Office of Substance Use and the Office of Developmental Disabilities. This just happened last week, so we haven't actually formally changed our name, but it did technically go into effect immediately when the governor signed off on it. So the goal is to try to make it easier for our patients who often are in working with all three agencies, to make it easier for them to maneuver our agencies. We'll see how that goes. Being in the Columbia level, like I said, I think I've mentioned before, it all comes down to the communities that you're in and the relationships you have in your communities. So, but we hope for good things. Department of Mental Health is also moving off of Bull Street next week to the new location where they'll be housed with DAODIS and DDSN up in Columbia. So that's a lot happening up in that building. They're all, I think they have to be out of the building by tomorrow. So I'll keep you posted on that. But other news we have, as you may know, it's the May is Mental Health Month. So there's lots going on also for that. And we've been involved in several community events on the weekends and in daytime and weekdays. We were part of Unity Day, which I think some folks here were part of. It's part of the pharmacy program that we all do downtown. Hospitals, treatment agencies, food bank. This past weekend, I think I heard yesterday we served 636 people and provided resources downtown. So that was a huge success. And let's see, what else do I have? It's also Nurses Week for those of you with nurses. So we are celebrating that here at the Mental Health Center. We celebrated at Administrative Professionals Week. And we have a calendar of wellness events for our staff this entire month. Every day we're doing something different at our mental health center to try to take care of our staff. And so it's kind of a fun month for us. And I guess my last bit of news is, I think I might have mentioned we were working on becoming accredited by the American Association for Suicidology, for our 988 program, our mobile crisis call centers, our statewide call center, and our mobile crisis team here in Charleston and Dorchester. And we heard last week that we have passed the accreditation for 3 years. So we're really excited about that. And now we will gear up for CARF that's coming next. So as many of you know, that lots of folks have to get accredited by someone, and it's a lot of work, but it just makes you a better place and more organized, put together, a lot of patient involvement in what we do, and being very person-centered and doing the best we can to reach out to the community and get services and resources out there to everyone. So overall, it's been a good week, and we're working on budget time for probably lots of folks who are on the fiscal year that starts in July. So a lot happening around here, but I appreciate all of you all, and many of you we work with a lot. Oh, I'll mention one other thing. We do have a mental health task force that we host here at the Mental Health Center. It meets every other month, and if anyone is interested in joining, please send me an email. This month it's on May 23rd. It's a Friday. It starts at 8:30 and goes till 10. But it's all providers of people interested in mental health or substance use. It's treatment providers, and we have law enforcement there. The judges are there for probate courts, and pretty much anyone. So if you're looking for information, or you want to see what resources are out there, or you have a problem that you need help with and you want to kind of come to a group of lots of providers, please send me an email and we can invite you. And it's on May 23rd. So happy Mental Health Month and Nurses Week and all that. So any questions for me?
Thank you, Jennifer, and congratulations.
Yeah.
I do want to give April a shout out for Nurses Week. We love having you on the call, and thank you for everything you do for the city of Charleston.
Thank you very much. I appreciate that.
Quentin, you have a question?
Well, I wanted to give an update on a few things, if I could. I
Please,
need to.
absolutely. Go ahead.
I'm here in Columbia amongst the all the chaos that's going on with the budget and all of that good stuff, but wanted to give a quick update before I had to drop off. We have established what we call Project Impact in our Charleston division here. And our group actually went out and about throughout the community back on April 11th and did service projects. And this was just an effort to get our care team members more involved in the community in the Charleston area, and serve as better corporate citizens by giving back and serving within the community. So we had over 200 care team members actually go out and volunteer throughout the community at several agencies, some of which are on this phone call here. The Along with that, Project Impact is also going to be hosting with my community engagement team. We'll be hosting a symposium coming up in August. I think it's on the 22nd at the Gill Yard. And this symposium is designed to bring in nonprofits from the community to learn more about MUSC and all that we have to offer. And we will educate them on some of the resources and programs that we provide. And also, we hope to have our care team members learn a lot more about some of the agencies and nonprofits within the community. So I'll drop it in the chat or get it to Paul so you guys can pass the word along. And some of you may want to attend and register for that. It's free of charge, but it's just a day symposium where you'll come in and learn a little bit more about MUSC. People often ride by the campus and not sure what building they're looking at. Some have received care, some have not, but we just wanted to host that for the community. So it's twofold. So we can learn a little bit more, and then they can learn a little bit more about us. So again, that's coming up in August, and I'll share that link. And lastly, I'll share, you may have seen the announcement early April that we are going to be building a new cancer center in Charleston on our campus, expanding our cancer center. One of our goals is to become a comprehensive, which is the highest status you can reach in cancer services. We want to become a comprehensive cancer center. And so the main building for that is going to be, of course, on our Charleston campus. So Hollings Cancer Center will continue to expand, and we'll be adding more in-depth research, more labs, more treatment space, and it will be located off of Sabin Street in that back area there, where the Rutledge Tower Annex is. So that's more to come on that. So it'll be a medical office building and a cancer hospital, and we are also expanding cancer services around the state. And we just made the announcement for some of those services to be provided in Florence and other areas as well. But just wanted to let you know what's to come with our downtown campus. So.
Thank you, Quentin. Appreciate that. And I'd heard about the Impact Symposium coming up. So that sounds like it will be a great opportunity for the community. And I look forward to it.
Thank you.
Paul, would you like to share Morgan Huey's updates now?
Yeah, Morgan talked to us briefly about the Charleston Moves and their organization, and so they have a couple events coming up this month. The first one is May 7th, is What's Under the Streets of Charleston, and that's going to be over at the County Public Library here on Calhoun Street from 6 to 7. I don't know how you register. I guess you go to Charleston Moves to register. So just to check on that. The next event is follows up with it's the National Bike to Work Day, which is May the 16th. And they've got two signature rides, the 7:30 to 9:30 morning. They're going to ride, I'm not sure exactly where it starts, but it's Rutledge Avenue is the location. And then they also have one later on in the evening from 5 to 7 o'clock, an event for people to get your bikes and get to. These are all at charlestonmoves.org. Finally, they got two more. The Ride of Silence is for those that have been injured or lost due to bicycle injuries, and that will be May the 21st from 5:30 to 8 at the start at Palmetto Brewing. And finally, Light the Night, May the 31st from 3 to 5 p.m., an event at Mount Moriah Baptist Church. All of those items are listed on charlestonmoves.org, and just encourage everybody to, start practicing some good habits and getting outside, getting on your bicycles, and being a part of all the wonderful opportunities we have throughout our community. So
Thank you, Paul.
Cover that. And then, Katie, I want to jump in, and I had talked to Jonathan Kessler a little earlier about he had asked me about why didn't I have Memorial Day on there, and I said, well, that was just a slip because Memorial Day is definitely one of the large events that we have in our community, and I want him to say a few words, but while he was doing that, I did want to bring up, just to remind everybody, Piccolo Spoleto is coming up in the end of the month, starting on the 23rd. And Memorial Day weekends at 24th, 25th, 26th. There are events that are going on in the city of Charleston, but every Memorial Day, there's always a big patriotic concert by the Charleston Men's Chorus, and the concert at Hampton Park featuring the Charleston Concert Band, etc. But we can't do enough to remember that Memorial Day is more than just a holiday. That is something very special that we take time to recognize. And Jonathan, I'll turn it over to you from here.
Sure. Thank you, Paul. This has been a great meeting. I feel like I've also learned a great deal, like Jennifer had mentioned. So I'm here at the VA, and we are celebrating Nurses Week and doing a lot of great things. Without nurses, we wouldn't get much done with our veteran patients. And we also have Joint Commission here. So as we're talking about CARF, Jennifer, we're also in the midst of that right now, but it makes us stronger and better in performing the work in which we do every day. So Memorial Day, I just mentioned it not to be rude, but I'm like, hey, Memorial Day. But of course, I work with veterans, and so it's always one of those holidays that I think of very closely in the work that we do here. So we all know it for a 3-day weekend, and we also, just talk about food safety. It also happens to mark the beginning of summer, so we'll start seeing the roads and tourists, flooding to Charleston more so than ever before. But a couple of things that I learned about Memorial Day that I didn't know all this time. It was originally known as Decoration Day, and it was established back in the 1800s primarily to observe the death of those soldiers in the Civil War. It was initially for the southern states. And then it expanded to include our northern states as well. But the first national observance of Memorial Day was May 30th of 1868. So as Paul had alluded to, this is a day for honoring and mourning the U.S. military personnel who died while servicing our United States Armed Forces. And so there's a lot of events that go on with that as well. But, even further, there's a lot of states and cities that they claim to have been, kind of the first to have adopted Memorial Day and really put into place, and not to ignore the fact that Charleston also observed a Memorial Day starting May 1st, 1865. So this is even before the national. And it was for the recently freed Black population. That they held a parade of over 10,000 people to honor 257 dead Union soldiers. So that is something I was not aware of. And Paul had up on the screen there a couple of events that I noticed. Two that came to my attention is the Taps Across America. And so what this is down in the Patriots Point in the museum at 3 p.m. Monday, May 26th, which is Memorial Day. The museum will take part in Taps Across America. And what this is a moment of remembrance that invites all citizens to pause for 1 minute in silent tribute while musicians across the country perform taps to honor fallen service members and their sacrifice. I have not attended that, and that sounds really interesting and very, heart kind of wrenching, honestly. But that's something that I'd like to be able to attend and participate in. And then there will be a Memorial Day concert, which is also annual. It's going to be held also at 3 p.m. At the Hampton Park. And so that will be free for everybody. So they just recommend bringing a chair and stake out a spot early and enjoy the music that represents America. And then across the Cemetery Administration, which is one of the 3 branches of the Veteran Affairs, in which I work for the healthcare side. They will be providing and honoring our veterans that have passed on Memorial Day as well. So a lot of nonprofits will do wreaths. So they'll provide wreaths and flowers and things of that nature on those actual grave sites. And if you weren't aware, South Carolina has 3 national cemeteries, the closest being Beaufort, and then there's Florence, and then Columbia as well. So, as we're marking the beginning of summer, just pause. And if you do so, maybe pause at 3 p.m. on Memorial Day, just to remember our fallen soldiers and military for that day. So thank you for a moment just to be able to share that. I learned a lot just doing a deeper dive, Paul. So thank you.
Thank you for sharing that, Jonathan. I
Indeed.
learned something from that. Thank you. Who else has some? Angela, would you like to share?
Yeah, sure. Good morning, everyone. I just want to give a quick announcement on behalf of Healthy Tri-County, which is our regional health coalition here. Our next conversation on health event will take place this Tuesday, May 27th at 9 in the morning. That will be held at Royal Missionary Baptist Church. The topic this time is maternal health and the disparities in that space. And we will have a discussion led by Simone Lee, who is the co-founder of the Bee Collection, and also their reproductive justice director. So we'd love for everyone to come out. It's free. It's usually about 2 hours long. You get a little light breakfast while you're there, and we hope to see you on the 27th. Thank you.
Thank you, Angela. Would anyone else like to share? Go ahead.
Yeah, thanks, Katie. Just very quickly, just to let everyone know, although it doesn't necessarily directly impact here in Charleston, we have just opened a new facility down in Hampton County. So we have over the last year, well, let's say last 3 years, let's say, but certainly over the last year, been constructing a new facility down in Hampton to replace our previous one. Our previous facility down there was about 6,500 square feet, totally inappropriate for not only serving the South, but also as part of our bigger border operations. So we now have a brand new 20,000 square foot facility down in Hampton County. About 40% of that facility is refrigeration and freezer space. The reason why I think that is so important is that it's going to help us in our ability to better serve our neighbors everywhere that we work. Here in Charleston, one of our biggest problems that we had was our refrigeration capacity. So our ability to take in fresh produce and to be able to store it effectively was really hampered by the lack of refrigeration space that we have. So approximately around about 40% of all of the food that we distribute is fresh produce. So that means around about 15 million pounds of food that's distributed each year is fresh produce. So having the new facility down in Hampton allows us to be more effective and more efficient in our ability to better serve our neighbors with fresh produce, because we can now bring it into the facility and we can be more strategic in the ways that we get it distributed out to our neighbors. And again, it relieves significantly the pressure that we had here in Charleston. So again, enabling us to be more effective in the way that we serve, especially with regards to both the frozen and refrigeration product that we have, which again is going to become increasingly important as we go forward and as we start to see potentially the need for assistance, unfortunately, potentially growing, and also some of the resources available starting to wane off, especially as we've come out of the pandemic era and the funding associated with that. So just a quick update on our new facility. If anyone wants more information on the new facility, happy to share it.
Thank
Nick.
you, Nick. Low Country Region actually covers Hampton County, so I'll make sure our community engagement team has that information. And I didn't realize that 40% of the food assistance that you provided was fresh produce. So that's great information and certainly good news for our communities. Paul?
Katie, just a question for Nick. Nick, I know the summer's coming on and more children will be out of schools and other locations. Is there a ask for the community that you want to push out any help, any areas where we need to help try to get people engaged for you?
Well, I'm engaging in the ways that people are. I mean, we obviously, it's a time of year where we really depend on volunteers, and especially at a time when a lot of the volunteers that support our work that are also themselves going on holiday as well. So they're on vacation. So volunteer support, certainly. A lot of our nutrition programs that we do also rely quite a bit on volunteers. So anyone that's interested in participating and volunteering and getting more engaged with the nutrition education part of our work, we're just launching what we're referring to as a street team, where this is having a more formalized and more effective approach to table events around our community to spread the word more around the work that we do. And also, again, looking for potential volunteers to help support those tabling events as well. I can send you some information on that, Paul, as well, which if you're if you're able to circulate, that would be great.
Thank you.
Thank you both. Any final comments? We've got 1 minute left. All right. Well, if not, Paul was reminding me earlier that we have one more meeting in June, early June, and then we take July off. Is that correct, Paul?
Yes.
Okay, so make sure that you have the June meeting on your calendar, and I hope everyone has a wonderful May. Lots of activities. Hope to see all of you out and about at some of those. Thanks for joining, and see you next month. Take care, everyone.
Thank you. Bye-bye.
Bye.
Bye-bye. Thank you.